Welcome, dear viewers. Today we're going to be covering another session on lessons on cupping, on correct cupping. We're going to be covering the problems associated with the eyes today, and we're going to be showing how to cup around the eye and other parts of the body which affect our sight. So we're going to begin by putting antiseptic spray on a tissue. Obviously you cannot do that on the eye itself, so you put the spray on the tissue and wipe around the eye. This is a ready-made cup which we've customized to fit on the eye. Now, if you have problems with your sight, if for example you use eye drops, then you would actually cup below the eye around the bag area, as is demonstrated here. But however, the main areas to cup due to sight-related problems, for example, if it causes you headaches or other problems, the main areas are your eyebrows and around the temple area, as we will demonstrate. So as we've shown in previous lessons, we're using a Bic razor. No lasting marks, no scarring, just gently gliding that along the skin, and that's all you need. You don't need anything bigger than that, and once you place the cup on that, the cut is sufficient to take blood out. So our resident cupping expert here has over 20 years experience in this field. During this time he's cupped thousands, tens of thousands perhaps, patients around the world. He has a formidable knowledge and expertise in this area. In fact, he teaches doctors at well-established universities on how to perform cupping. So if we look at the amount of blood, given the spot, I'd say that was quite a lot of blood. So we've actually demonstrated this lesson so far using an electric cupping machine. However, we realize that not everyone will have this device, so we will demonstrate how to perform cupping with the handheld pump here. The handheld pump achieves exactly the same results. It's obviously it's not as efficient as the electric pump, especially if you're doing it upon yourself, but the desired result is the same. As you can see, hygiene is very important. Our resident cupping expert changes his gloves every time he cups one point. So another point to cup when dealing with issues related to the eyes and sight is the temple area. So as usual, we put the initial cup on to mark the spot, and now the cut. There's very little risk. I realize that we're actually cupping the temple area, but despite that, there's very little risk. And we're not cutting the skin too deeply with our Bic razor. Okay, so blood is already starting to come out now. Small little puddles all over, dripping down into the base of the cup. Obviously this is a bit more of a sensitive spot, being around the temple, so you might want to vary the strength. This very much depends upon the person being cupped, what his pain threshold is like. Also, I've noticed, just from personal experience, that that the pain from the cupping can sort of persist for just a couple of days, perhaps, depending upon how strong this particular area is, how strongly it's cupped. But nothing significant. So as you can see, the areas which we're cupping are around the eye. So it's on the eyebrow, it's below the bags under the eyes, or it's on the temple. And all of these areas affect the eyes, the sight of the patient. And that's generally one of the common themes you'll find in the whole science of cupping, that you will in effect cup either the area of pain causing the patient distress, or around it, as we're doing here with the eyes. Okay, it's very dark. It's toxic, coagulated blood. Now this mark on the skin, this slight reddish mark, may well persist for a couple of days. So if you're going into work the following day, you might want to factor that in. So perhaps having this done on yourself on the weekend or on the Friday would be the best time. So in regards to the actual mark on the skin around the temple area, there are actually ways to disguise it so that the mark isn't so visible, and that's to use, for example, this foundation cream we have. Just blend the cream into the skin, it becomes much less visible. And the marks around the cup will also remain for perhaps 1 or 2 days, but that too will disappear. So the reddishness is very much gone. You can perhaps see it close up because of the light from the camera, but from a distance it's not quite visible. It's largely just the round cupping shape which we can see, which will go in 1 or 2 days.